Hey everyone, my name is Eric Anderson. I'm a registered nurse and a student in DNP at Jacksonville State University. This is a quick overview of the Renal Reserve Initiative. It's a presentation based on chronic kidney disease in the state of Georgia. This is a secondary prevention strategy. Here we have a quick overview of the table of contents. Included in the presentation is just an overview of kidney disease, how it affects Georgians, examples of primary, secondary, and tertiary prevention, the Renal Reserve Initiative for Kidney Health Program, interdisciplinary team and their roles within the program, the DNP's leadership competencies within the program, and finally we have a reference page. On this page we see a chart that shows chronic kidney disease. It is staged 1 through 5 based on the patient's GFR, which is a glomerular filtration rate, and it's a test used to determine how much blood passes through the glomeruli of the kidney per minute, and it's measured in a percentage. Chronic kidney disease is defined as a decrease in kidney function as measured in GFR for 3 consecutive months. Damage to the kidney can come from uncontrolled diabetes, hypertension, polycystic kidney disease, and even recurrent urinary tract infections that can scar the kidney. Chronic kidney disease is progressive in nature and can sometimes lead to end-stage renal failure and require the use of dialysis to remove waste, water, and balance electrolytes in the blood. End-stage renal disease occurs when a patient's GFR drops below 15%. Diabetes is the leading cause of kidney failure in the United States, type 1 and type 2 diabetes. Early testing and management of diabetes means less chance for CKD to develop, and if it does develop, we're not allowing any kind of delay in healthcare. As a diabetic myself, I remember being tested for CKD at a very young age and being put on preventative medicine to assist and make sure that I don't develop any CKD. Some complications of CKD include fluid retention. This leads to swelling around the arms, legs, which is also known as edema, and high blood pressure. So high blood pressure can cause kidney disease, and kidney disease can cause high blood pressure. Elevated potassium, this is one of those electrolyte issues when your kidney is unable to filter and process the electrolyte balance within your body, and it can impair the heart's ability to function. Weak bones, anemia, a decreased immune response, and if uncontrolled long enough, it leads to end-stage renal disease, requiring either a transplant or dialysis. The management of CKD includes management of hypertension, management of blood glucose, so the diabetics out there have to get regular A1C checks, which is a measurement of your average blood sugar for the past 3 months. The National Institutes of Health wants it less than 7%. Cessation in smoking, and then finally nutritional changes. The rate of chronic kidney disease in the state of Georgia is ranked as the 6th highest in the country. This has led to deaths of over 2,000 Georgians per year for the year of 2019. And it occurs at a rate of approximately 18.5% of Georgians. So, prevention strategies. Primary prevention strategies are basic general health promotion. It's altering your susceptibility or reducing your exposure, especially if you're at risk. So as a diabetic myself, this is just general health promotion that I do every day, that anybody would do every day. Exercise, proper diet, staying active, staying up to date on your immunizations. Those are all kind of examples of primary prevention strategies. Secondary prevention strategies are early detection and treatment of a disease at the earliest possible stage. This would mean regular lab work that's done, and they see a drop in your GFR early on, so they catch your CKD while it's still stage 1, stage 2. And this means that they're trying to prevent you from progressing on to stage 3 to end-stage renal. Tertiary, this is a strategy that's implemented during the middle or late stages of the disease. And this is to alleviate any kind of disability and restore functioning as best as possible. So maybe you're stage 3 or stage 4 and you're borderline on that dialysis requirement. And this is any kind of strategy that's used to prevent you from having to utilize dialysis to manage CKD. So since secondary prevention focuses on early detection and treatment of disease, almost half of the people with severely reduced kidney function, 48% according to the CDC, they were not on dialysis and not even aware of having CKD. So secondary prevention with screenings and testing and lab work and staying up to date on your health care can assist with you managing the disease earlier on in the process. The Renal Reserve initiative is going to utilize GFR with referrals from physicians and hospitals, but it's also open to the public who may be at risk to help manage any kind of CKD or prevent any kind of further CKD issues. The big thing for secondary prevention for CKD is blood pressure optimization and glycemic control. Those are definitely more early stage interventions. So maybe you have stage 2 renal failure and you have an acceptable GFR. These are one of those things where we try and just work on your A1C to lower your A1C, get it down to that goal of 7, or bring your blood pressure down to have a systolic blood pressure of less than 130. With late CKD, if you're in that stage 3, stage 4, it's managing other comorbidities such as uremia and cardiovascular disease, and trying to avoid any kind of move forward to dialysis or a possible kidney transplant. The Renal Reserve Initiative. The initiative's goals are to utilize an interdisciplinary team to provide secondary prevention to those with a GFR less than 50%, so stage 3 CKD, via telehealth visits and monthly in-person blood work. The aim of this initiative is to reduce the incidence of CKD-related deaths in Georgia by the year 2022, and is to help patients provide a better understanding of CKD, what options are available to Georgians, and what they need to do to help prevent from furthering their disease process. The big thing on telehealth is by offering telehealth, we're ensuring compliance and individualization to the patients that are part of the Renal Reserve Initiative. Those patients call in, they have their lab work read to them over the phone or via FaceTime, or any other kind of mobile video chat app. And this allows a very individualized experience without the stress of having to get to an office. According to one study, telehealth visits have been shown to offer benefits including eliminating travel time, which can be a barrier to healthcare. It can incorporate many other healthcare advocates, like if we need a dietitian on board, or the DNP will be there answering the phone call and having the discussion with the patient. Maybe occupational or physiotherapy can get on board and discuss exercise. And it allows patients to also feel at home because they're at home discussing their care on a computer or a phone screen. It makes them feel more comfortable and more involved. The interdisciplinary team members that are associated with the initiative are the referring and the admitting physicians, the advanced practice nurse, the DNP, registered nurse, registered dietitian, and then volunteer medical and nursing students. The roles of each of these is the MD is going to assess for a GFR less than 50% and refer to our program where another doctor will admit. The DNP is the interpreter of the data. They introduce therapies to the patients, and they're also the program leader. The RN is to do a patient assessment, education on CKD and what it means for them. The dietitian probably plays one of the biggest roles with the nutritional assessment. Patients with CKD require changes to their nutritional status to optimize their functions and help alleviate any kind of electrolyte imbalances or protein imbalances within their diet. According to one study, this pre-dialysis nutrition therapy counseling delays progression to stage 5, and that's what we want. The nursing and medical students will help compile data to be assessed 2 years after program initiation, and that data will be interpreted by the DNP. The DNP competencies involved in this program is one is a project manager. They're an organizer. They are analyzing data. They're coordinating with the care team and with the patients and all of everyone involved. And with that project management portion comes communication. The DNP is able to appropriately communicate clinical information and data information to be reported and then reevaluated and then allowed to make changes within the program to help assist patients with their management of CKD. Communication is also essential to the referring hospitals, physicians, and patients who choose to enroll in the program. The program evaluation, participants will be logged and have their lab results trended to see any kind of progression of CKD. If their GFR continues to drop with non-compliance with the program, or if they stop being involved in the program. We'll evaluate the number of patients that have not yet transitioned to end-stage renal disease to evaluate the effectiveness of the program. We'll also take feedback from patients on the program, which will allow some growth within it. If the telehealth visits aren't working, maybe we'll move to in-person or vice versa. And the overall goal is to see a downward trend in the incidence of CKD-related deaths in the state of Georgia. Here is a list of references. Thank you for enjoying the PowerPoint. I hope you have a nice evening.